For over 15 years, I was an attending doctor at St. Barnabas Hospital in the Bronx, where asthma is epidemic. And we found that with our treatment, people had fewer days of school or work missed. They needed less medication. They were overall healthier people. Asthma has three components. It has a mechanical component, just the movement of your ribs and the muscles that move the ribs to open the lungs and move the diaphragm is a very important mechanical component of asthma. And with normal breathing, you only use 2 or 3% of the oxygen in the body to move your ribs and open up your lungs have your diaphragm move up and down. With heavy exercise, you might use 25% of the oxygen in your body. But if you have muscle tension or restricted motion of the ribs, walking across the room can overwhelm a patient with asthma, and they can end up needing to be intubated or worse. There's also an autonomic component. The older medications were all geared towards the sympathetic hormones and neurotransmitters. The sympathetics are the flight or fright hormones, and those medications for asthma help the lungs open up, help the bronchioles open. However, they have side effects. They make you jittery or moody. But we can treat the autonomic nervous system to bring balance to it so that your body produces the right chemicals in the right amounts. It's not as harsh and it's more balanced. The new medications for asthma deal with the inflammatory component. Medicine is just recently recognizing the role of inflammation in many diseases and the function of the lymphatic system to help that process progress. Inflammation is a normal response to injury or irritation. Asthma is an irritation in the airways. And then there's inflammation, which is a healthy response, but it needs to get cleared away. And the clearing away is done by the lymphatic system. Dr. Still knew about the lymphatics over 100 years ago and taught how to treat them. And that's one of the things that we do with asthma, is to stimulate lymphatic function to allow free motion, first of all, and then stimulate the lymphatics to clear away those chemical irritants as part of the inflammatory cascade, so that you don't need a medication to intervene. Your body will do it when it's allowed to, when the structure is normalized. And with persistent inflammation, we see chronic conditions and scar tissue forming. So asthma responds very well to osteopathic treatment.